Sponsor and don't necessarily reflect those of the station or iHeartMedia.
Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everyone. Welcome to the Dr. Pannozzo Medical Show here on 1230 WBZT and our sister station, 94.3 FM. Good morning, Dr. Pannozzo.
Good morning.
How are you?
Morning.
And in the house, we also have Manx. We have Linda Harmonson back there taking notes. Dr. Ihart at the board operation. We got everybody in the house. Doc.
Yes.
How are you doing?
I'm doing great.
Anything happening spectacular in the world of Dr. Pannozzo?
Oh, every day. And first of all, we had Monday. A lady came in hanging on her son, teenage son.
Hanging on her son?
Hanging.
Was I there?
She couldn't walk. No, you weren't there on a Monday. And,
what does hanging on her son mean?
Vertigo.
Oh.
She couldn't stand up straight. She couldn't walk. And we took care of that. And then we saw her again on, I think it was Wednesday or Thursday, and she walked in by herself with her husband, and I saw her husband too after that. So it was one shot, took care of that vertigo.
How old
people
was
are going to sit there and say, how is that possible? It is absolutely possible if you understand what causes vertigo.
How old is her son?
About 17, I think.
Really? And you know, there's a question in the questionnaire, but I'm going to ask it before we get to that. The vertigo comes from where, Doc?
It comes from an injury to the top of the neck.
And if people tell you they can't remember ever being injured,
that's okay. They're not going to remember.
They're not going to remember it,
no.
Correct? And the injury that occurs, is it the same for everybody? In other words, does everybody feel the injury?
Yeah, it's an upper neck injury, and no matter how you get it, from automobile accidents, from motorcycle accidents, from football, what they're calling concussion is actually a neck injury, and is treatable, and doesn't cost you hardly anything. I know they're spending billions on this, on concussion, and we sit there and laugh at these. I mean, what's going on here? They don't know how to examine anybody, I guess. I don't know. It's but we get the results, and now one thing you have to understand about ringing or vertigo or migraine, no one can test for that.
Okay.
When you say you have it, you have it. That's it. So then we try to get rid of it, and then as it improves, then you say it's improved. But there's no test for that.
And does the vertigo disappear little by little, or is it just gone?
Right now, boom, 2 minutes.
And you told me there were two areas that you work on with the vertigo, correct?
Yeah, there's one on each side.
On each side. And if you do one side, it may come back and you have to work on the other?
Well, it'll go a certain amount, and then but not quite gone, and then we take care of the other side, and that's it. 100%. We have a 100% cure rate for this. I mean, you can't believe it. In medicine, if you get 85% cure rate, you're doing good. But I'm getting 100% with this.
And you know, there used to be a baseball player that played for the Minnesota Twins. And also the Miami Marlins had a baseball player. And right in the middle of the game, they used to call timeout. And he used to run in. He was a center fielder, for all things. And when he was getting an attack of vertigo, they stopped the game and they brought him in.
Wow.
It's a true story. They made a movie about it that I saw years ago, and they redid the movie because of these players. And it's funny because you have some of the greatest doctors' minds, allegedly, working on the situation, and they could not fix them.
Oh, because they're surgeons and there's no surgery for this.
But they're looking in the wrong place, Doc.
Hmm?
They're looking in the wrong place.
Well, that's the reason, though. They're really good doctors, but they do surgery. This is not a surgical problem.
Right.
So right off the bat, they're eliminated on the thinking process, and it is. Medical doctors have a thinking process to go through diseases, and most of the time you don't even know the doctor's thinking about this. But it's a thing. I do it myself. I mean, we come up with just a history and a clinical exam, but everything else is already thought about in my mind. And so I said, well, this is what you have, and this is what I could do for it right now. And we do it, and they get the result we want. But it's a thinking process, and unless you understand how these things happen, you're not going to get it. And this is the problem with the orthopedic surgery. They're really great on what they do, but this is not what they should be doing.
That's right. They're good to go in and take care of the business they need to take care of. But this particular deal with vertigo and even scoliosis, I got to admit, to a certain degree, these are other areas that you've actually found ways of fixing.
Yes, we did the research on it. We even went to the anatomy lab at the medical school and did the research on that. So it's a foolproof system, and I'm telling you, people ought to take advantage of it. I think there's a lot of people out there that need it, and they should try it. If you're going to talk to your doctor and say, we never heard of anything, but they'd have to talk to me first.
Yes.
Before they can say that. And so we can do it. In fact, Manx here films a lot of this.
Well, we're going to get to Manx in a second, but I just want to touch on the vertigo, migraine, and ringing of the ears. Three separate incidents, correct?
No, all from the same place.
Okay. Yeah. Now, are these outcomes, what you're feeling, are different things to the same kind of illness? In other words,
all
you have
from
one
injuries to
from
the
the same injury.
Same injury to the neck.
And it's creating three different
symptoms.
And see, now, if you were to tell people they got ringing in the ears, or they have this, or they have that, vertigo, they wouldn't see it that way. They'd say, no, I have vertigo. I don't have migraine. Or I have migraine, I don't have vertigo, but it's really in the same area, yes?
It's all the same area, and as far as we can know now, what we're talking about is actual experience.
Right.
All these symptoms are caused by the same area. When we treat it, they all disappear.
And none of these people have ever come back, unless you had to work on the other side. If you work on both sides, has anyone ever come back for any of these three?
No.
Which is amazing. Amazing.
I can remember one lady came back after 3 months, but we only took care of one side. So she came in, we did the other side, and she's very happy.
That's the norm. Now let's get back also, you aired your Pannozzo medical show on Channel 19.
Yes.
Which is the reality piece of what you're doing, because Dr. Pannozzo is like an onion, and he's just creating more and more layers. A lot of people saw it, and we were talking off the air a little bit about it puts a lot of skeptics in a real bad position, because you can't you can't deny, and the guy who shot the film is sitting in the studio, you can't deny that what's going on now is real, and the stories that are coming forward, and you're taking pictures of it, you're taking film of it, you're getting witnesses of it. You've stayed in late because people, they want to get fixed, and you're filming the whole enchilada. And Manx is in studio. Manx, let's start with you. How do what's your take on what's going on as you see it develop?
It's like mind-blowing to me, no matter what somebody comes in for, because you think you've heard it all, the same thing. I know he has, for as long as he's been doing it, but maybe I haven't.
Well, you're an outsider looking in, because you just started filming the show for Dr. Pannozzo, and I'm impressed because, and you and I both are patients. Yes, we are. We don't attest that we're not. He's worked on both of us, but that's not the reason we do what we do. But you're looking at him do what he does, and you're seeing it. You've been seeing it every day now for months, and you're filming it. Are you surprised at the outcome of what's going on? Do you see things that change? I think you have a story of the week for us.
Yeah. Well, this guy came in. He's a jiu-jitsu expert now. Or I guess he trains in that. But he was a kickboxer champion back in 1999. He had 25 pro fights. He did something to his knee he went to the doctors that he went to, and they told him that not that he had a tear in his meniscus, but he had a scrape.
A scrape, not a tear.
Because blood was showing up, supposedly, and when they drained some fluid from him, and then he says to them, which I thought was pretty good, they wanted to do surgery. They wanted to do arthroscopic on his knee, and he says, I know you guys know a lot, but he says, but I already have the best doctor that you can get. And this doctor would do, he would accomplish more than what you guys would do without surgery, just by what he does.
He was referring to Dr. Pannozzo.
Dr. Pannozzo, yeah. And which is kind of cool to hear. And then to test what he did, because when he came in, Dr. Pannozzo always does an exam, but he tests people for where their pain's coming from, so that you can try duplicating it after he does his treatment and see if you can produce the pain. And this guy's like he's on a wrestling mat.
He was on the floor.
On the floor. I've never seen anybody get on the floor, and he's doing all these moves, and moving his hips and moving his knees, pulling his knee like across, and he wasn't able to duplicate, the pain after he had the injection. I mean, he did have, I guess Dr. Pannozzo treated him before I started filming there. He had,
It was last year.
Patella.
It was last year,
Yeah.
wasn't it? But that feature that he's describing is you're not going to leave the office with the same pain you walked in with. So when we treat it, we're going to wait the appropriate time, 2-3 minutes, and then I'm going to ask you to get that pain again. If you can't reproduce that pain after your treatment, it was successful and is not coming back. So that's how we talk to anybody listening, that these are cures, and we know they're cures because the pain's gone. It doesn't come back.
Right. And 1-800-889-0267, if you have a story we'd like to hear from you, good, bad, or indifferent. Dr. Pannozzo is not gun shy. If something hasn't worked, or you come to see him, you weren't happy, whatever, Manx stepped on you, whatever the deal is, give us a call. 1-800-889-0267, and we'll repeat that because we like to hear from you. But I also want to clarify something. Mm-hmm. When people go in to see Dr. Pannozzo, and he does his thing, he does his procedure on you, this isn't like going to see somebody who gives you a package and says, I'm going to fix you, here's a banana and an apple, and voila, you're fixed. It's not the way it works. Everybody's individual. All the pains are treated individually.
Right.
I see the conversations that you have with people, and it's amazing because I know that you're looking to see where the pain is coming from. They're going to tell you where they think it's coming from, and you're going to say, okay, this is where it's coming from, which is uniquely different in this field.
Yeah, I take the calls so we can, if somebody's really suffering, I can bring them in right away. And then I ask questions about where that pain is. And I've seen so many things, and I know pain patterns a lot. So we can find out where this pain is coming from, and then I could schedule that in to take care of it. Because my time is limited, I'm not there 24 hours a day. So like a knee, we could do that right away. A wrist, we could do that right away. Lower back requires a little more time, about a half hour.
And we want to stay away from MRIs. Please do me a favor. Don't bring an MRI. He gets nuts when you do that. We don't want you to bring in things that have not worked in the past. We know why you're here. You're here because you're in pain. And you're in pain because whatever you were doing.
Yeah, people actually bring their tests with them and want me to look at them.
Yes.
So what am I looking at this for? You had a doctor who looked at this.
Yes.
We don't look at anything.
That's not what
start
we're here
from
for.
Scratch.
That's right.
Original history, clinical exam. Oh, we got somebody on the phone.
Who you got on the phone now? What's it?
Frank.
Frank, you're on the air.
Yes, hello.
How are you?
Good. Dr. Pannozzo, how many injections for ringing ears does a person have to get, and how many years of treatment or months of injections on the neck does the person have to get?
Well, it depends on everybody's individually different, but we don't have anybody past 2 or 3 times coming in the office. It's not years, it's 2 or 3 times.
Now you said 2 or 3 times, 2 or 3 visits?
Yeah, 2 or 3 visits, that's all.
Yeah, because I've never seen anybody go further than that.
We had a guy who was
The car deal.
very prominent person who really was going to do it to himself because he couldn't stand it anymore. But he came in every day for 3 or 4 days, but it cured it. He fixed it right up.
And he's not bad.
So everybody's individually different. It's not a good question to ask.
Yeah, everybody has a different formula, and we were just about to touch on that, Frank. It's interesting you brought up that question.
Can I say something else?
Sure.
The injections, are they cortisone? What kind of chemical?
Well, we're not going to discuss that. They're just anti-inflammatory, that's all.
Oh, okay.
Yeah,
Well,
but they're not. I can guarantee you it's not cortisone. That I can tell you.
It's not narcotics, nothing
It's
like
nothing narcotics. It's a pretty amazing medicine. It's the way Dr. Pannozzo uses it.
Yeah,
You know.
it's why and where you use it, not what.
That's right. And that's the difference, Frank. But if you
want
have
an appointment, sir?
if you have ringing in the ears, Frank, or you have any ailments, trust me.
You want an appointment, Frank?
My 12-year-old son. I took my 12-year-old son to
He
see
doesn't want an appointment. He just wanted to
see
find out.
Pannozzo's. And I wouldn't put my kid at risk if it was, especially if it was cortisone. That was the first thing I asked him. And I was a patient of yours, and that's the first thing I asked you. Is it cortisone? And he says, Freddie, don't worry about it. It's not cortisone. I'm going to take care of it. And that's the deal. So it's a trust factor. We know it's new. It's been on the air for years.
Well, everybody gets a printout. I'll give you what the drug is. I'm not going to discuss it with you. Just read it yourself. It's the
Right.
same thing I would read. That's all.
But we also checked against anti-doping rules. It's accepted by the MLB. It's accepted by the
problem with
NFL, NBA. It's not a doping sequence, especially the way it's administered.
Absolutely.
And that we want to be very, very, very
strictly
clear about it.
anti-inflammatory.
Yes.
Has no muscle-building properties at all.
Not at all. And the thing here is that it's how you actually work it, and that's the part of the secret that people don't get.
It has to be in the right spot.
That's right. But finding that right spot is your expertise. That's right.
Master diagnostician.
And I could tell you because he's put his thumb in my elbow, and I saw stars. And he did the same thing to my shoulder. And I know a lot of people who are doctors, and that's never happened. This guy made me cry because he put his finger right on that spot.
Well,
I think he took care of your shoulder too. No?
But he put his thumb in my eye socket too.
Did you fix that?
Yes.
Good thing you don't have ED.
Hey Doc, I'm actually getting involved with an ED company next week. Not for me, but for some commercials and stuff.
Is that right?
To be continued.
I've been thinking about this. I think I'm going to have
I knew it was
I'm going to have a solution to this. Not yet, but I'm thinking about it. It's all a matter of physiology. How does this thing work?
They say blood pressure.
No, nothing to do with it.
It's amazing. He comes up with a cure for that. We're going to retire. I'm done. I'm just going to go on the road with you and resolve that issue across America. I won't do anything else. What do you think there, Doctor?
A one shot to cure it all.
One shot to cure. Can you imagine? No. Well, first of all, the shot thing is kind of scary, but
Yeah, I think I'd pass.
you don't have to pass. You just got to close your eyes.
No, I mean pass out if
Oh.
he took out a needle.
All right.
It
that's
is.
good.
It is a serious problem, and all joking aside,
It is huge.
If we can fix that, then we should offer it. But I have to have someone who wants me to experiment with him a little bit.
Thanks.
Manx.
Oh yeah, well, I'll film it too while he's doing it.
There you go, man. We'll show you from the neck down.
Yeah, film it.
But the bottom line here is, ladies and gentlemen, 1-800-889, give us a call. 1-800-889-0267. Tell us a story, like Frank
Can you
just
say
asked.
that slower?
1-800-889-0267.
There you go.
Give us a
Now,
call.
call in.
Call in and let us know what you think. Give us an opinion. All right. Question. I got Jerry from Boston writes, I follow your shows on Pannozzo.tv. That's I forgot to say that. You can follow us and see us on Pannozzo.tv. You can pick up his app, Pannozzo.tv, at the wherever you buy your merchandise app store, and download it and follow us. Take us with you. And I wanted to ask, if all the areas that you work on, does the pain come back after 3 or 4 months? Is the secret in what you do, or is the secret in how you apply the medicine? In other words, is the medicine the secret, or what you do the secret?
Well, it's no secret. It's just a science. That's all.
Well, it's what you do, Doc.
Predictability and reproducibility, and that is a science. And the pain does not come back from the same area that we treated.
Well, sometimes
That
you
doesn't
also,
say you can't have a pain from somewhere else. I mean, sure.
well, you got to follow the pain. You may have a couple of stops to get to where you need to go until you get there.
Well, he's talking about 4 months. That's not going to be true.
3 or 4 months.
New injury.
It's funny. Maybe Frank wrote this question.
Frank?
I've got him called before. How many years? Have you ever had to treat something that took more than 6 months?
There is a condition of the lower back where you have a huge spur formation, which is a repair process, by the way. It's laying down bone. And those require, and it's usually L4-5, and usually requires a series of treatments until it comes apart. And that's the only system I know about that does that.
Really?
Just the lower back in this one particular spot.
And what do they do currently to adjust that right now?
Well, they suffer and
Operations?
operation, yeah, which makes it worse because it's scar tissue anyway.
Now, when they operate, what are they getting taken out?
I don't know.
Are they taking the inflamed tissue?
Well, I don't know what the heck they're operating on because
And what do they fill it with?
everything is treatable. You don't need an operation at all.
I know, Doc, but they're doing them. So when they
They're
take
doing
out the stuff,
Well, they don't understand the physiology of pain production. Now, it's in my book. The concept, there's a physiology of normal, and then there's a physiology of pain production. What happens to the structure that causes the pain? Where is it and why is it? And it can be fixed. MRIs do not tell you that. That's why we don't use them. And so it goes on like that. You have to understand pain pattern, anatomy, and physiology in order to do the treatment that we do. And I do it all for you. It's just a thinking process.
it's really funny because so much inflammation throughout the body, like scoliosis.
We met a guy who freezes the body for 3 minutes for
Oh yeah, that guy.
inflammation.
That was.
I treated him.
You treated the guy who owns
Yeah.
it?
Yeah.
Do you know they have a new one in Boca? Somebody was telling me about.
Really?
Yeah, and they freeze your body for 3 minutes and
It
you
might
come
be
out.
the same guy, by the way, because
And he owns it and came to see Dr. Pannozzo.
he had like 4 places that
Yeah, this is a brand new one that just opened.
he has one in the Hamptons too. That guy.
It's funny because one of the people that watch your show, one of the females that watch your show, wants me to set it up. She wants to come see you because I told her, don't do that. Don't freeze your body. It doesn't make any sense. It may give you a sensation.
You know why you don't want to freeze the body? You're over-treating. These painful areas are only ligaments. They're only this big and that wide. That's all.
And all the blood rushes to that organ to protect it, doesn't
Well,
it?
it's injury, and every time you move, it lets you know I'm injured. So you have to know what causes these things, and that's what we talk about, the physiology of pain production. And then you could fix it, and then you can't produce that pain anymore.
Right.
So it all works together. It's really a nice system, and I thought of it. It's great.
Well, I happen to like the way you think because all the other ways, you always end up going back to the doctor. And sometimes the cure is worse than the pain, like having surgery. I don't want nobody cutting me open. I just
And you don't want
that.
any treatments either
No.
by technicians, therapists, and so forth. It's wrong. If the doctor can't take care of it, you ought to walk out of there.
Yeah, you got to find a different way of.
Now, I don't want people coming back, so we want to fix them the first day.
I mean, we like you, but we don't
I'm
want you
too
to come
old
back.
for that.
What
you know?
doctor? What doctor do you go to that tells you he doesn't want you
Doesn't
coming
want
back?
you to come back.
I mean, that's just.
I mean, this is just upside down.
He answers his own phone and he tells you he doesn't want you coming back.
And he works, which is the other upside down. You know, if he didn't work, if it was a scam or something where the doctor did something and it doesn't work, then I would say, okay, we're done with this. But it works.
I believe Thursday were 10 new patients, right?
Yeah.
Something like that.
Hey, it's working because the snowbirds are coming in. See, Doc, it pays to invest in the North. Everybody hears about you.
Yeah.
And this Channel 19 thing is taking a life of its own. I'm really impressed with it because it answers people that don't get it. And you can't hide from the truth. Just like you can't hide from the truth. If something didn't work that you did, you would have to answer to it. But it works.
What we don't like is people complaining it didn't work, but refuse to come in for a re-examination.
That's right.
That is not fair to me.
Let's finish the deal.
Disrespectful.
That's right.
That's what that is.
And there is times you got to come back, and there are times that Dr. Pannozzo has to chase, and there are times that you need the other side fixed. There are things that have to be done.
Absolutely.
But let's finish the deal and then say it didn't work, if it didn't. Now, before, it's not an apple and orange
Right.
juice
Now, people will
solution.
get a bill. They have to get a bill. We have to run the office. And I like to eat.
Yeah, it would be nice.
Believe it or not.
Yeah,
Right, Manx?
That's right. But if you're going to exhaust anybody's treatment, you should be exhausting Dr.
Yeah.
Pannozzo's.
Yeah. I mean, I know people that go to the doctor with the same ailment for 4 years.
Right.
Yeah, well,
And they didn't complain about that.
here's the thinking
That's
process that patients use, and it's not correct. They'll think, well, my insurance won't pay, so therefore I have to go where it does pay. Well, you don't know that that's what you need. You have to go where you need to go to get well, not where the insurance company will send you. They have a game they play with you. If they'll offer you a surgery, more often than not, you'll say no. So they save that money.
Well, you know, Doc, sometimes.
And then you suffer with it. We know that's true because they come in the office,
Well,
right?
sometimes more
That's
is
right.
less because you go where the insurance companies pay. They're putting stuff in your body that shouldn't be there.
Well, you don't get the results. Nobody gets our results. So I always tell people, yeah, go. You can go where your insurance, but you're knocking
back.
your success rate down. If you come to me, you got to pay a little bit if we're not on your insurance. But why are we not on your insurance? Get an insurance that we're on. That'd be more logical thinking.
Oh, you know what? Pay and chase your carrier.
Like Blue Cross Blue Shield, we're on most of their plans, so that's a good one to get.
Chase and pay and chase your carrier. That's what I
That's
advise
I
people.
think that's the thing.
That's the best
Go
way of
after
doing
them.
it. Obamacare is changing. Everything's changing. But pain don't change.
Right.
The one consistent part of this equation is pain. And when you're in pain and they do nothing and nothing helps, you know what? How long are you going to live? I love it when a person is limping around, right? And they went to the doctor for 3 months. And how you doing? Oh, I'm doing much better. And they're limping around.
You know,
Because they don't want to admit that it isn't working.
that's true.
We had a limper in. I got to tell you this, by Big Lou.
Big
You
Lou.
know
Big Lou, yeah, at least once a week.
This guy gets hurt and on his knee, and he goes to the surgeon, right?
Yes.
Miguel, and
Oh, that
no, I
was
shouldn't
Lou's
say that.
latest guy.
uh,
Latest guy he sent you, Miguel.
and I examined his knee. I said, "There's nothing wrong with your knee." He says, "Well, they told me this, they told me that." I said, "Look, I'm showing you the thing. There's nothing wrong with it. It works fine. I can't even make it hurt." So I examined his hip. I said, "Your problem is in your hip." He could not believe that, could he?
Nope.
I know, because Lou, I went to see Lou the next day. He says, that Dr. Pannozzo. Unbelievable.
So it was one injection into his hip ligament, and not even the hip joint, it's the ligament. And that knee pain left. Then we saw him again a couple of days later for a recheck, right?
Yeah.
And his problem was, I can't remember what it was,
I'm trying to remember.
but it
too.
wasn't related at all to the knee. And the knee was normal, the hip was now normal. I examined it, and that was the end of that.
Well, Lou, I hope you're listening. Lou is another exotic case. He goes, you fix his neck, that he couldn't move.
Oh,
He goes to a chiropractor.
yeah, messes the whole thing
It
up.
messes the whole thing up, and he sees me. And I go, he was crying. He was in such pain.
Wow.
So I said, what's the matter with you? He says, I went to the chiropractor. And I says, well, why would you do that? Well, because he was a friend.
Oh, jeez.
So I said, go back to you. Now, he re-injured himself, Doc. I don't even know if you worked on him when he re-injured himself. He was in a lot of pain.
Yeah, well, we took care of his lower back and everything. Well, listen, people make their own choices of where they want to go. We're responsible for what we do for the patient, and that is a big responsibility. So, and we don't mess around. No drugs are given ever, and we don't send anybody out for therapy or anything like that. We take care of the whole thing. It's all physician treatment.
That's right.
That's why it's good. I'm responsible for what I do, and I'm trained for it. And these other people aren't. If you're going to go to certain practitioners, I mean, they may not know what they're actually treating.
Well, he looked worse.
Yeah.
He was actually in tears. He couldn't move.
Yeah.
That's what I'm saying. Sometimes
Got
less is
another
more.
question?
Yes, we got a few questions. Saxy from Boston writes, I saw a show about scoliosis from a senior lady that you treated. I think we know who that is. My daughter is only 22 and has a very bad case of scoliosis. And I wanted to know if you could help her. And I remember Boston's new to the market to you, Doc, so they are just learning you. What would the procedure be for scoliosis, and how long before you can see some kind of improvement?
Well, we see the improvement right away. Remember, there's scar tissue from an injury holding the spine crooked. So that's a different thinking than what the surgeons will tell you, which is they want to put a rod in there to prevent it from getting worse. You can't get better with a rod. So that's not good. You should not do a rod. My treatment is proven. It works. It's good. The trouble is, we don't know what's involved with her, this particular person. But we treat scoliosis every day of the week, and it works. In fact, we had two 15-year-olds. I love 15-year-olds. You can take care of them really quick. And their curvatures came out right in front of their mother and father.
They didn't have rods, though,
They
right?
couldn't believe this.
No.
Obviously, you're looking at it. It's true. It's right there.
Now, what happens to what's pushing the spinal cord when they put in rods?
Well, it's all a lot of scar tissue, and anybody who does that has a lot of inflammation everywhere the bones meet, all the way down. And that rod goes all the way down. And it just makes me nauseated to look at that. I said, what in the world?
It's so painful, too.
See, the thinking is wrong. They're thinking we got to stop it from getting worse, so let's put the rods in.
Right.
I'm saying that stops you from improving. Let's not put the rods in. See? So what would you rather do?
I'd rather not have the rods, I could tell you that.
If I had a 15-year-old, I would absolutely not. Or a 22-year-old, I would absolutely
Change
not
their life
have
with
any
those rods.
surgery on that. Because it only makes it worse.
Well-
We can fix that. We really can. And believe me, people, I'm telling you the truth. We can actually do it. Well, what do you say,
The
Manx?
15-year-old girl, that was the tennis player, right?
Well, there's a few of them. Yeah.
And she had one shoulder higher than the other, and she had,
Yeah, they were
Mild
treating her for
scoliosis.
a shoulder because the shoulder was heavy.
Mhm.
But they couldn't understand that the spine was crooked,
yeah,
causing that.
and he did an
You have a
insert.
question in there.
just
Somebody
gonna
was going to
read it.
get a surgery on their
I was just going to read it.
T1.
Yeah, Ruben from New York City writes, I've been diagnosed with nerve damage in my shoulder that kills the feel of my fingers and makes it hard to lift my arm. They want to remove tissue and even a rib to give the nerve more room and increase the flow of blood to my arm.
Yeah, they don't need to do that.
And that has a syndrome name to that.
There's a syndrome there, and we were talking about a baseball player a couple of weeks ago.
He started throwing again.
Oh,
He started soft tossing because he wants to get back. He's a free, he gets a new contract. This
He's
year.
not going to get back until they take the curvature out. So this is a curvature between the shoulder blades for this person.
Right.
That has to be corrected first. A lot of times people have a bad neck, and you look at below the neck, and there's a curvature there. You have to fix that before the neck because, see, a curvature below the neck causes a curvature above the neck. You still have to look like you're straight.
So, okay, so let me get this right. So this surgery is performed. They're not doing anything about the inflammation.
The
that's
cause,
causing
they're not after the cause, they're after the result.
it. So they're just giving. Is it true that removing a rib will
They
increase
do
the blood
remove a
flow?
rib, and that's true.
And it increases blood flow.
It's called thoracic outlet syndrome.
That's correct.
But if his fingers are warm, there's no flow problem. He could have a stretch of the nerve, though, over the rib, and that's what they want to cut out. But instead of doing that, take care of the curvature and take the pressure off of that. That really works. It's you see how sophisticated it is, though. That's a thinking process that the person has to do when he's examining someone like this.
So they should do two things instead of one.
What is it?
Cause and effect.
Cause and effect. There you go. Cause and effect. The effect is here. What's the cause of it?
So just removing the rib is not going to resolve the
no,
issue.
that's the wrong thing to do.
And you think it's a case of scoliosis in play? Yes.
No, all of them have that. Yeah.
That's amazing. Most pitchers have scoliosis.
Yeah.
because of the inflammation they create with that jerky motion.
Well, they're doing things that hurts between the shoulder blades, and they could have it from other reasons, though. I mean, there's a lot of reasons
Right.
for having a scoliosis. You could have a motorcycle accident and get it. I mean,
That hurts. Okay, 1-800-889-0267. Give us a call. Talk to Dr. Pannozzo. Let us know where it hurts. Let us know where it hurts. Jennifer from Boston writes, my husband and I sat down and watched some of the shows on your website. Again, that's Pannozzo.tv.
oh, nice. Thank you.
We loved the last show you had. A client explain how his shoulder was worked on by doctors and had to be fixed by you afterwards. Max, I think that's you. The scraping of
me.
the bones.
Really?
That's what, you're known in the business as the man with the scraping of the bones. Never heard of that before in my life. Do all surgeries have the same inflammation after the surgery is performed? This is the first part of the question. In other words, scar tissue.
Scar tissue.
All of them get scar tissue, yes?
Scar tissue.
No matter what.
No matter what.
Okay, so the answer to that question is yes. She had knee surgery 3 years ago, and there are days that she still can't walk, and the knee feels tight, and the pain is worse than when she had the surgery done.
Well, I tell you, there's no reason to operate a knee. It's just too simple.
But what do we do now?
Huh? What? Well,
What
we
can
have
we
to
do?
look at her and take care of the scar tissue, and then she'll be okay.
So is it the scar tissue is creating all the pain?
Yep.
That's pretty simple, isn't it?
It's exactly what
I
was
think we should
happening.
complicate things a little bit.
Yep.
That's too simple of an answer.
It is.
You know that? Don? You make it too simple. People can say, nah, he can't be right. It's
It's
got to be
not-
something.
It's not simple. It's very complicated.
We have to operate on
It
your...
took me years to appreciate all this because it's not taught this way. It's taught by surgeons who, if you have a pain, they want to do therapy and then a surgery. And I'm saying you don't need the therapy, you don't need the surgery. We can treat all that.
Isn't that amazing, though? 1-800-889-0267. Give us a call. Let us know where your pain's at.
MRI of the knee, by the way, should not be done, or the shoulder. It's just too simple of a joint. And if you understand how it's made and how to examine it, you don't need an MRI. MRIs are misleading.
How much does it cost to have an MRI? You ever had one?
I think it's-
$350?
No, I think it's more than that. I thought it was 1,000.
I thought it was $1,200 for
Well,
somebody.
years ago it was. I think it's a little less now, but I don't know.
Well, that was a long time ago. But an MRI is nothing more than what? Why do they perform MRIs?
Well, they want to know what's in there, and they can see what's in there, but the trouble is they don't know what's causing the pain, and they can't find it out by that. First of all, it's not a weight-bearing film. It's
What
a
kind-
laying down.
You're lying down.
Is
It's
it?
interpreted by someone who doesn't know you, doesn't see you, doesn't talk to you, doesn't examine you, does not take a history. He doesn't know what he's looking at. He just reads everything.
So you're having this MRI done by a stranger who then tells the doctor, I think it could be.
And the doctor didn't examine you either.
Wow.
He didn't take a history, so he doesn't know what he's talking about. So you got three people that don't know anything. You got the guy who ordered the MRI, the guy who read it, and the patient. All three are going to make. I mean, that's how mistakes are made.
You had an MRI done?
I had an MRI of my jaw.
Of your jaw?
I couldn't even finish it, the MRI,
On your jaw?
on my jaw, because you have to put a splint in your mouth. They open your mouth as
Okay,
wide
take
as...
it easy. All right. All right, take it easy. Okay, we got a phone call. Who's on the air, Doc?
Donna from New York.
Donna, New York City. You're on the air with Dr. Pannozzo.
Hi. I have been getting for over a year, and I know other people have this. It's like a wobbly. You know, like I'll just sort of jerk off to the side and, you know, like whatever. I just sort of sometimes stumble.
Like vertigo?
That's a vertigo. Yeah.
It's not vertigo. I've had in my life dizziness. I had whiplash. I really have to see you. But I wonder if this particular thing, you know, they did tests where you close your eyes and walk. And, you know, I thought, my God, if I ever got pulled over, I have my prescription, which I haven't filled, for an MRI, because I don't want to do that, of the brain, you know, that I would show a policeman and say, look, you know, I'm not drunk or anything. And
Do
and I
you
know-
wobble when you're driving?
Nope.
That could be scary.
No, you have plain vertigo, and we could fix that.
Well, it's not vertigo. I don't feel dizzy. It's like...
Well, you don't know what dizzy means.
yet.
You're
yes,
wobbly.
I do.
That's
I've been
vertigo.
dizzy often in different ways in my life. And, you know, you could classify me as dizzy, but, you know, like, no.
Well, Donna,
I've had.
I'm going to tell you, when I went to see Dr. Pannozzo, I told him I had pain in my foot. And he says, no, the pain is in your hip. I said, no, doc, it's in my foot and in my knee. He said, no, the pain is in my hip. So when he says dizzy, I mean, we have to classify it so that people who are listening to the program sort of can relate to what's happening to you. To you, it may not mean dizzy. It just means wobbly. I mean, wobbly, dizzy, you know, it's just semantics. But the bottom line is very dangerous when you drive if you get an attack.
No, I don't have that.
But all you have to do is have it once. And what I tell people is if you have it once and you're driving, it could be very, very dangerous.
But if you're anywhere near Florida, why, we can fix that in a day.
Yeah, come on down.
Because I'm the yes.
Come on down,
Good.
enjoy the beach.
Because I had whiplash. You know, I broke.
Well, that's what we've been describing. We've mentioned
Yes.
this already.
Well, you think that would help? It's like someone I know who has MS. You know, and the way they walk and stumble. This is a particular thing.
She wobbles.
Well, MS is not sine qua non of unsteadiness like that.
No, I think
First of all, MS is overdiagnosed a lot of times. But anyway, getting off the subject.
I think that what she has is maybe the beginnings of something that's going to grow.
Well, she had a neck injury, and she's a little wobbly when she stands around and tries to walk, and that's fine. That's at least that's a verifiable symptom, and we can examine for that person.
Excellent.
Thanks for the call.
And Donna, let me. You got a pen and paper?
Yeah.
I'll give you his phone number.
Oh, I know it.
Oh, you know it. Okay. All right. Come on down. Let me know when you're in town.
Come on down.
We'll film you and put you on the air.
You have breakfast at Poppy's and lunch at Francesca's. And,
That's very nice. And you never wobble again. You're going to wobble in and you're going to walk out.
And you go to the
Wobble
beach.
on in. Can you say what? Can you talk about what insurances you do take? I know I have Medicare, and I know you do that.
Yeah.
But for other people.
Well, it depends on what they buy. You know, if they buy New York insurance, GHI, we're on that one. I don't know. It just depends on the patient should always call their insurance company and say, "This is what I'm planning on doing. Will you pay for it?" And they'll tell you, "We can't do that." They're not going to tell us, but they can tell you you're buying it.
Okay.
And then you'll know. So, yeah.
And you think they would be honest?
The insurance company, no. That is not.
Well,
You know, the problem is that they don't know what to do with Dr. Pannozzo.
Yeah.
Because Pannozzo wants to cure you. He doesn't want to see you again. Nothing personal. He doesn't want you coming back. And that's not the way the medical field in that position is working right now.
Well, you know why? I'm just too old for this. I mean, I want to fix you one time, and that's it.
That's right. You know, Pannozzo's 24 years young, so he wants to be able to do something else. But
Thanks
Donna,
for the call,
thank you
Donna.
for calling, and I appreciate it.
Thank
We'll
you.
see you soon. All right, there you go. The wobbly syndrome. You see, Doc? We got a new syndrome today. Wobbly. Wobbly? Yes. Okay.
You know, the biggest problem you have as a physician trying to interpret what somebody's telling you in their history.
Yeah.
What's bothering them. For instance, you have a pain on the right leg. No. But it's stiff a lot. You know,
Well, to her, wobbly.
as long as it's one leg, I
Yeah.
mean, that's an
But to her,
abnormal.
wobbly and you know,
So, yeah, that's a part of communication that you have to learn as a doctor. You got to learn all that.
and I don't want to tell you that I have migraine. You know, like, Doc, I got a migraine. No, Doc, my head hurts. Because I don't want to use certain words to make it sound worse, right? It's a scrapey over there. Okay, Alex from Boston writes, I suffered lower back pain for many years and was told to lift weights to straighten the lower back. Doc, do you want to hear something strange? When I was 18 years of age, which makes a whole lot of sense to what you tell me is going on with my body, I used to be a catcher and I had horrible lower back pain. And they made me lift weights to cure it. It must have made it worse because I mean,
You know what's wrong with that?
Tell me what's wrong with that, Doc.
The wrong tissue. It's not muscles, it's ligaments. So you can't lift weights for ligaments. You can take the stretch off, and that's part of the treatment. So you have to analyze the physiology of pain production. Remember the physiology of pain production over and over again. So you have to find out what it is, and then why it is, and then how to fix it. And then we do that in one visit.
Well, that's a good explanation, and it separates people not understanding the fact that we're not dealing with muscle.
Right. People say, oh, it's muscles. No, it's never muscles. Muscles, you can strain a muscle, but it lasts 3 days, and that's it. It automatically goes away.
And the
In
ligament
fact,
strain?
I just did it to myself. I was showing somebody how to do squats, and I strained my
And you hurt
quadriceps, and it was there for 3 days, and all of a sudden it was gone. No, that's true. So any pain other than that, 3 days, is going to be ligaments, and those are treatable separately. But you have to know why they're being stressed, because a pain is a stress on a ligament, right? Inability to stretch is another way to look at it.
Right.
You can't bend over. Why? It's a ligament pull. Where is it? Well, we have to start there. So it's very scientific. People ought to look into it. There's nothing like it anywhere.
Well, that's a good explanation, Doc, because a lot of people confuse muscle pain with ligament damage.
Right.
And you worked on a few bodybuilder friends of mine, and I always wondered until today how he did that, because I did not separate muscle from ligament damage, and you worked on the ligaments.
Mm-hmm.
And they were able to go back in the gym and start lifting.
Right.
Because you didn't work on the muscles.
Yeah. So why? Because we took the stress off of the painful one.
Look at that. I learned something today. Did you learn something today? There you go.
Yes.
Yes. Sammy from Boston writes, love Boston. I have been given painkillers for sciatica and sent to a chiropractor to remove the crippling pain in my legs that does not allow me to even walk. I believe now that after hearing and watching your show on Pannozzo.tv, hint hint, that perhaps this is not the best procedure to follow to fix my problem. Sciatica problems, I've been told, has to do with my flat feet. You're going to disagree with that because I already know where you're going with this. And she's a school teacher, so she's on her feet, and they say that the reason her flat feet and her being a school teacher is hurting her sciatica.
Wrong.
How did I know you were going to say that?
Wrong in all
The whole thing is wrong.
First of all, chiropractors do not have a program for what's bothering this lady. If you have a pain in the leg, it's an annulus pain, and they do not have a program for that. And even physical therapist does not have a program for that.
And what is annulus, Doc?
An annulus is a ligament between the vertebrae. And when you sprain that, that's what they call a herniated disc, and they want to operate that, but you don't need to, because it's just a ligament, and it's treatable. But where was I going with that?
Sciatica?
Sciatica is just a term. It means pain in the leg. There's no meaning other than that.
Now, when that pain goes down your leg, on the back of your leg.
There's a source for that. It's not a sciatica. There's a source for
Is that a nerve?
No.
What is it, muscle tissue?
No, it's a ligament. It's a ligament.
Down the whole leg?
Yeah, a ligament referral.
Really?
Yeah. Sometime you need other things for a nerve. You need tingling of the toe for L5. You need little toe tingling for S1, bottom of the foot for S1, top of the foot for L5. So there are ways to diagnose that. But it's not taught that way. But the main thing is the chiropractors have no treatment for the annulus, the ligament. None.
And Doc, swelling,
I treat them.
what about swelling at the bottom of the feet with this condition? Is that common?
Swelling?
Like your feet swell up. Is that common, or is that something
No,
else?
that's kidney disease or liver disease or heart disease, not a pain.
Gotcha. So even though you have that at the same time, there's more
But
going
we
on.
also look at alignment, find out what's going on, the engineering of the thing, and that's another aspect. But we do this automatically, though. When you get examined, we figure out the engineering of the body, and the first thing I'm going to tell you is that you're engineered properly. We don't have to change that at all. If you're off, causing an injury, then we'll fix that.
Gotcha.
And the whole thing works out really, really quite. What do you think, Manx?
What do I think?
Because he films these things.
I mean, he
And,
sees it, man. Tell us what you see.
I see exactly what he says, but I'm losing my sound on my earphone. What impresses me the most really is that he treats everybody as, even if you came in on a Monday and came in the next day on Tuesday, he treats you as you're a brand new patient again, and he's re-examining you, you're lucky if you get examined by any other doctor outside his office once. I mean, he's examining you every time you come in.
Right.
That's true.
That's
In fact, Medicare asked me about that. They said, well, you're charging too much for a re-examination. But I had explained to them that that pain is gone the first day. When you come back with another pain, it's another area. We have to examine for that. We have to refer back to the x-ray. We have to take a history. We have to know and do an examination. It's the whole deal over again.
Have they ever come to visit you, Doc?
Who knows?
Yes.
We don't know. They did visit a patient of mine. In fact,
And we sent them some nice DVDs.
yeah, they've never seen anything like this.
Nobody has, though.
Nobody.
That's what's happening right now with Channel 19,
Yeah.
which is Wednesdays, 5 to 6 on the, what is it, Uverse?
6 to 6:30.
Your verse.
6 to 6:30.
And do you remember the website?
WEY.
WEYW19.com.
Say that again slowly.
In
Doc.
stereo.
WEW 19.com.
That's right. Watch Dr. Pannozzo's.
WEYW.
YW, I was going to say.
WEYW.
19.com.
All right, watch him on Wednesdays and Fridays, 6 to 6:30. And you can see the inner workings of Dr. Pannozzo. Okay, 3. All right, let's get another question there real quick. Jackie from New York City writes, I follow all your shows here on Manhattan Cable, which you're on 5 days a week, and planning to come see you for my migraine headaches.
Yes.
I wanted to ask if migraines are caused by injuries to the neck area, and is your procedure the only known cure for this problem?
Yes.
Anybody disagree with that? Anybody's heard anything
They
else?
can't because they don't know what I'm doing. I did the research on it.
But any other research right now does not cure migraines permanently. You do.
Yes.
He stands by that. Excellent. Lester from New York City writes, I saw a show where you spoke about vertigo and how you treat it. Have doctors called and asked you how to follow up with this procedure?
We don't know. Sometimes we get a call and they never say who they are. I mean, if somebody wants to learn how to do it, I'll teach them. I mean, it's not a problem. I can't treat 6 or 8 billion people in the world, you know.
Yeah, you can, one person at a time. Brandon from Washington writes, saw your website and was surprised to hear. Are we out of time? 2 minutes? Brandon from Washington writes and saw your website and was surprised to hear that ringing in the ears is something that goes on in your neck. We spoke about that earlier in the show. So let's move on. Norma from Miami writes, painkillers in Florida seems to be out of control. You do not give medicine. You do not give pills.
Nothing.
None of that. Come on in and let him fix you up without giving you pills. And if you want pills, do not come to see Dr. Pannozzo. And do not bring an MRI either. Just keep the man sane. He doesn't want to see it, doesn't want to hear it.
Good program. Thank you very much.
It was excellent, Doc. Again, as always, thank you for doing what you do. Dr. Pannozzo also sponsors the Two Boys from Brooklyn Monday through Friday, 12 to 1. We have fun with him on there as well. We're going to actually try to have you come on the show one day.
Oh, that'll be good.
That'll be fun, right? Manx, thank you for doing what you do. Continue to do the hard work you're doing.
Thank you.
And ladies and gentlemen, thank you for tuning in. We'll see you next week. Visit Dr. Pannozzo at Pannozzo.tv. 561-381-5800 is his number. Give him a call. We'll see you next week.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561 381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.
1230 WBZT West Palm Beach and iHeartRadio.